Aquacare Physical Therapy. Welcome. This is really exciting for all of us to have an event where we've got lots of dancers and lots of parents here. So tell you a little bit about Aquacare. If you think about Aquacare, what do you think about? Water, right? And so I like to say over 25 years we do water, aquatic therapy, but we do so much more. And so tonight's a great example of what we do. So over 25 years, we're always trying to find things that is the need of the community. And so very exciting when Katie Oakley, PTA and Dance Medicine Specialist, came to me 3 years ago and said, I really want to start a dance medicine specialty. And so as a CEO of Aquacare, I was like really excited. Again, we want to offer specialty programs. But as a mom, I was even more excited because I have a daughter who is a dancer. Over here, Gabrielle. And so over the years, I'll give you a little bit of a story. And this is a story that probably most of you can relate to. Gabrielle was a dancer at 4 years old. Over the years, she's been part of Feet of Fire. She's been a competitive dancer. And she's lived the life of most of you where you dance till 11 at night, you don't eat really healthily, and you have a schedule that doesn't allow for great stretching or keeping in shape. And so that's the life that most of you probably lead. So I was really excited when Katie came to me and said, we need to do something different. We need to find a way to address the needs of a dancer who is an athlete. And many dancers don't think of themselves as an athlete. And so we started a dance medicine program 3 years ago. Personally, Gabrielle has been part of that for the last 3 months. She's seen Katie for the last 2 times a week. And I can truly say, no longer is she coming home and saying, oh, my back hurts, my knee hurts, my ankle hurts. And that's been over the years. I'm sure many of you can relate to that. In addition, I believe, and others are saying, that she looks better. I don't know the words, but she's kicking higher. Her jumps are better. And so I give that all to Katie and the things that she's accomplishing. So tonight is about treating a dancer as an athlete. And we know that we're athletes, but we don't always think of ourselves as athletes, or the community doesn't think of ourselves as athletes. You're not a football player. You're not a basketball player. You're not a lacrosse player. Your needs are much different. And so that's what tonight is about looking at you guys as an athlete that has different needs. And knowing that it's not about physical, but it's about the fact that you have physical needs, but also mental needs and nutritional needs. Again, you dance to 11:30 and you expect your nutritional needs to be met. So thank you for coming. And without further ado, I'm going to introduce you to Katie Oakley, Dance Medicine Specialist and PTA at Aquacare Physical Therapy.
Hello everyone. So like I said, Her Horizons, I see many familiar faces in here. My name is Katie Oakley. I'm a PTA and Dance Medicine Specialist at Aquacare Physical Therapy. I just want to thank you all so much for being here tonight. Ever since we started this program 3 years ago, this is something I've always wanted to do because I feel like being a dancer myself, there are so many needs that aren't being met and that we should have access to. So that's what tonight is about, is giving you those resources and answering any questions that you may have. So thank you. So before we get into the nitty-gritty, just a little bit about myself. I got my Bachelor's of Science degree in Exercise Science from Salisbury University, and then after that, through working at Aquacare, I went and got my associate's degree in Physical Therapy Assistant, and then most recently, I'm a certified Dance Medicine Specialist practitioner. My current roles, I'm a staff therapist at Aquacare 2 minutes down the road. I'm guest choreographer for a lot of local studios for competition, and then I'm also a choreographer for community players. So for dance experience, I have over 25 years in training in all different styles and varieties. I went to regional, many national competitions, cruise lines, you name it, I did it, and a lot of community performances. So this is me and my background, and this is why I love working with dancers, because I was one myself. So a little bit more about my certification program. It was a 4-part certification program through the Dance Medicine Education Initiative based out of New York City. And my mentor has been a PT for many, many years, based out of New York. She is with a lot of the Broadway shows. She is backstage, she is in it. She is currently working with the Tisch Dance Company, and she also teaches anatomy and physiology for the New York Ballet. I absolutely love this program. It was very intensive, but it was a Friday through Sunday 4-part course where you went every single year and you got a new certification. So one time I would go and it was all about the foot and ankle. The next time it was knee and hip, and then the lumbo-pelvic region, and then finally we ended with the cervical thoracic region and shoulder girdle issues. My most favorite memory is we currently have mentorship Mondays, so every month they contact us and they ask, are you having some issues with any current patients? Do you need, an extra eyes on things? They are here every step of the way. I just took another course last weekend all about releve and plie and the biomechanics of that. So continuing to learn, continuing to grow, wonderful, wonderful certification course. I think it's so important to have membership. So like Dr. Curley will talk about, he has published a lot of research articles in the dance medicine community, and I'm a part of the American Physical Therapy Association with special interest group in the performing artists. And then I'm also a part of the International Association for Dance Medicine and Science, which is IADAMS, also known as, and then Dance Medica. So I'm constantly trying to stay up to date on the most up-to-date research and evidence-based practice for the dancers. So a little bit of overview and summary of what we're going to be talking about today. So why work with a professional? Why work with a dance medicine specialist as compared to another physical therapist or physical therapist assistant? What's the difference? What are you going to get out of coming to me? When to work with one of us? The most common dance injuries and how we will use certain interventions to, go with that. Some exercise demonstrations from some of past and current patients and how to contact us. So why a dance medicine specialist? So here you can see Katie Weber on the right and then Shannon Arney, who is right here. They are 2 of the physical therapists that I work alongside every single day. If you come to me and do an evaluation, you will probably see one of them. We recently hired a new doctor of physical therapy, Kristen Jackson, who actually danced with University of Maryland, Baltimore, who is wonderful and who is so interested in the dance medicine community. So if it wasn't for these women, I couldn't do what I do, and that is so important to me. With that, we speak the same language, we know the culture. We know you need to get a 540 jump by next week. We know that an Alice Cone turn or a Firebird or a leg hold turn, we know all of those languages and that French aspect. Some of our exercise specialists will look at our flow sheet and they're like, what is this other language? We get it. Expectations as a dancer. We know that a lot of you are gearing up for your recitals, for national competitions currently. What are you doing to support yourself so that injury doesn't occur? We know the cycle of the dance year, those 8-hour intensives of learning choreography for your upcoming competitions. So that's what we understand. Our personal dance experience, we know what we went through. Although dance has changed a lot of the same things still apply. You'll receive an expert evaluation where we go over your strength, your range of motion, vestibular exercises, and with that, we'll create a customized plan and program for you. The most important thing that I want you to get out of tonight is making connections. You may come in with just a knee or an ankle sprain, or you're having some popping hip. Well, why are you having that? Is it because the core is weak and you keep falling out of your turns? And that's why the ankle is compensated? There's so many connections as a dancer. We get down to the root of that issue. You're not coming for just an ankle sprain. And of course, safety considerations. We understand the type of floor you're dancing on, the shoes you're dancing with, so on and so forth, the costumes. So when should you work with someone? Well, obviously, if you have a pain, that's a pretty good reason to come in. But we do a lot of injury prevention. So as you're gearing up for audition seasons and stuff like that, it's really important to come in for a strength and conditioning program. If you have pain that's been persistent for longer than a week, it's accompanied by a loss of joint motion, swelling, numbness, tingling, instability, wakes you up at night, present at the start of activity, or it gets worse as you're going across the floor. It causes compensated movement patterns. So if you're having that popping in your hip and you're starting to hike your hip because you don't want it to pop, that would be a compensation. Frequently injured, every spring you go and do your spring show and you tend to roll your ankle. Well, why is that? Or it seems to take a long time to recover from an injury, imbalances in strength, flexibility, or control, hyperflexibility, or you're working hard, you're doing privates twice a week, and what you're trying to obtain is just not getting there. A couple reasons to discuss. So we consider a lot. Some of the past things is we consider your past medical history, your general overall health, of course, past injuries, past and current training habits. How long are you at the studio? Are you at the studio 6 times a week, 1 week, and then only twice the other week? Your dance history and your genres, menstrual patterns or lack thereof, flexibility, strength, balance, or coordination. So overall, our goal as dance medicine specialists is help you to continue to learn and grow. We want to support you. Many of you are wanting to go off to college and do this or be a part of the dance team. How can we support you and create the best body we can for you to support you with that? And of course, to stay happy and healthy as dancers. So a couple of our dance injuries that we see all the time, it's definitely not a comprehensive list, but for the most part, ankle sprains, patellar tendonitis, nondescript low back pain, hip impingement, labral tears, and sacroiliac dysfunctions of the hip. So with all of these, the main thing to do is to reduce the pain first. So there's a lot of different ways we can do that. We can use manual interventions, get in there with our hands. Instrument-assisted soft tissue mobilization, we do that through Theragun, our hands, cupping, edging, myofascial release with or without movement, and then trigger point dry needling. We actually now have 2 clinicians at our Milford Street office that are certified in dry needling. And then through that, we want to then strengthen you and improve your mobility and range of motion. So to do that, blood flow restriction, alignment corrections, reformer-based exercises, lace pause, and motion guidance laser. So some of the services that we offer at Aquacare, we have our post-injury rehab, we have our injury prevention services, return to point work protocol, and then our jumping protocol, and all of our dance screenings. All of that can be done with a physical therapy rehabilitation. That's what you normally think of when you think of PT. You come in, you see a physical therapist, they evaluate you, they come up with a plan, and then you're seen 2 to 3 times a week. Most recently, we've offered cash-based PT. So this gives us a little bit more flexibility with insurance. So say you're preparing for auditions or you're not really having any pain, but you want to work on specific dance techniques, that would be where you would come in for cash-based. But it's really customized to whatever you want. We have pre-point assessments and screenings. This is so important. There's so much research on point work with dancers. And Harkness in New York City has actually developed a 12-step checklist for dancers on what marks you should be hitting before you get into point work. And that directly correlates with your injuries and injury prevention with starting point work. So we offer that. And then PT Plus is something we're so excited for, and we actually utilized it at James and Bennett's Rock and Roll Revival. So Melanie, she was volunteering anyway for her son, and we had a couple patients that were performing. They were like, oh, I just wish I could have that Theragun or the tape or my alignment corrected. So we were able to go to them in between shows and do what we needed to do to make sure they were at tip-top shape for their performance. But this is not just for stuff like that. We can come to your studio, your gym, your home, anything like that as long as you're a current patient. So that's been something wonderful that we've added this year. A couple other services at Aquacare. So we do seminars just like what I'm talking to you about tonight. We also do a lot of workshops. And the neat thing about the workshops is it can be completely customized to what your studio needs. So say you've been off all summer and you come back and you're getting ready for Nutcracker auditions. Maybe Miss Elena would like you all to have a workshop class or something to strengthen you before that audition. I can come in and do a workshop just for that. I can come in and do a workshop for the top 10 pre-point exercises to make sure all of you are on the same page with that. So it's really customizable for whatever your dance studio needs at the time. So, I'm very excited about this slide. Shannon helped me with this. So, what I wanted to get through to you, this is a very common dance move. This is our leg hold turn. Very good technique, wonderful. And what I wanted to talk to you all about is what's something that you feel like immediately is inhibiting a leg hold turn? Anybody? When you think of your leg hold turn, what are you like, I need to improve? Yes?
My arm strength.
Well, your arm strength, yes, you're right. But flexibility of the leg, arm strength, anything else?
Ankle stability.
Ankle stability, yes. You guys are good. I was thinking flexibility was going to be the number one.
Core stability.
Core stability, yes. So, what I want you to understand is something as simple as a leg hold turn. I mean, it's not that simple, but there's so many different variables that go in it. So I just had a dancer. She had the range of motion. She had the strength to get up there, but she still couldn't do a leg hold turn. What was stopping her was her flexibility in her lat. And her lat is a muscle that connects the back of the arm kind of down into the ribcage and the spine. She did not have enough motion there to grab her leg to pull it up. We cupped that lat, we massaged, I gave her some dynamic exercises, and then she was able to do it. So it's something as simple as that I had my dance training for however many years, and then I had my therapy training. That is a perfect example of marrying the two and putting it all together to see, well, it's not just ankle stability, it's not just the flexibility of that hamstring, it was actually upper body that was causing her not to get it. So just a great example. Some other things, Shannon actually just developed a vestibular protocol for dancers. We had one dancer that was just getting recurrent ankle sprains anytime she went on stage. And what we found was her proprioception and her vestibular system was so thrown off when she went onto the stage. So because you're dancing in front of a mirror, your teacher might say, okay, let's turn it to the other side maybe once. Well, when you get on stage and you have the sound, the lights, you have all of that input, but no visual input to go off of, it throws you off completely. That's one of the reasons that she kept getting those ankle sprains, because she was completely thrown off. So we've developed a program for that, which has been super exciting. So, can I have my volunteers come up? Gabby, Larry, and Gabby. Okay, so we're going to go through just a couple of exercises that we do in the clinic. This is definitely not a comprehensive list. You guys can have a seat on the table. Lily, you're going to be first. Sorry. So this is Lily, everyone. So she's going to be demonstrating, it's called an airplane, and we're going to do two different variations of it. So the airplane is actually a test that we use when you first come in for an evaluation. And depending on the technique that you utilize, you get a certain score. And that score correlates with injury. So let me pull this up. I did videos of these as well, just in case. Oh, apparently I'm professional. We're just going to ignore that. Okay, so the first, go ahead and face the side. Go ahead into the start of an airplane. So she is going to hinge at her hips. One leg is going to come up. Good. And she's going to be completely 90-90. Now, she's going to bend this bottom knee, and her arms are going to come down, and then back up, and straighten. And she's going to see how many she can do of these with proper form. Now, here's where dancers get thrown off. Immediately with this one, you want to turn out your hip and go into kind of a penché type thing. Go back down. I want her hips stacked on one another because that creates that neutral spine and that protects that back. Okay? We're going to go down and up. This is a really good knee stabilizer exercise as well. Straighten and then down. Now, you saw the motion guidance laser on my intervention, so you can relax. If she was having a really hard time with the stabilization of her hips and kind of finding that, we would put a belt on with the laser here. We would have her go down, we would let her see that laser on the floor, and then as she does the exercise, she can see the visual cue of going down and going up and making sure that laser doesn't move. Dancers are very visual people. They need to see what they're doing is correct. Okay? Now, a little bit of different variation. So say she really wasn't getting the airplane and we had to take it a step back. I'm gonna have you face the front for this. So she's gonna hold the ball out. She's gonna come into passe. She's gonna shoot this leg back and she's gonna pass the ball and then come back up. Okay? She does this one.
I don't do it with the passe.
Oh, passe. And then shoot the leg back and then pass underneath and then back up with the passe. Yes, you got it. And then she would keep going. The most important part is the neutral spine for this one, the pass, and then coming right back up. Okay? Good job, Olivia. Okay, so next. Okay, Kathy, you're next. You're the next victim. Okay, so how many of you have been given the correction in class where you go to do a prep and your knee comes in? Raise your hand. Yeah. So visually in like proprioception, you don't know when your knee's coming in unless you're looking in the mirror, right? It's usually caused by that glute med strength of the hips. So this is a really good exercise. So put your knees together. I don't know if you've done this one before. So we'll see how good you're at it. Okay, so she's gonna come back into a prep, just a plain jazz prep. Yep. Now, from here, she's gonna keep this knee forward. I would probably have a mirror in front of her, that way she has some feedback. And then she's gonna bring the back leg out into external rotation, hold for 5 seconds, and then come back in. Now, what I see if people do this knee will just go with her. But she's having to stabilize here to keep that other knee forward. So really, you would think it's an exercise for the right leg. It's actually an exercise for the left. Good. Was it hard? Not too bad? Good. All right. Next, we're going to do around the world. So, with pirouettes, falling out of turns, you have a lot of input. So I'm going to have you stand on here. These are called around the worlds. You're going to come into passe. She's going to hold the kettlebell, and she's going to take it around her. This gives so many different aspects of a turn. I could have her do turned out, coupe, plain jazz, and then I put her on an air X to make it a little bit harder. We would probably time this for like a 3 count of 8 for however long a fete turn is, and then go from there. Good. Good job. Okay. Yeah, you're next. I did not tell them what exercises they were doing, so they're like terrified. Okay. Usually I would have shoes off for this one, but don't worry about it. So these are something we got probably a couple months ago. They're called functional footprints. These are wonderful to have in the clinic. You can use it as a diagnostic tool to see how far the hips are externally rotating without any feedback from the ground or anything else. So it's purely hip rotation. I'm sure most of you have heard Don't go into first position and then straighten up the legs. You have to purely use your hips. So, I'll hold on to this. So for this one, it's used as a diagnostic tool, but we use it for exercises as well. So she's gonna step on. Good, she's gonna straighten her knees. Now she's gonna come out into first position. Now from here, if I was doing an evaluation, or Shannon was doing an evaluation, I would see, okay, she's at 55 on her right and 50 on her left, so I would just make a note of that. Now I want you to try and hold where you are and go into plie. Good, and then hold. Usually you shouldn't see any variation in the degree, okay? You had about 20, but it's okay, that's okay. Next, I'm gonna have you step out, or step off, yep. We're gonna widen, we're gonna go to second position. This one is where you feel the burn. Good, so she'll go into second position. Good, she'll go down. I want you to think of butterflying the knees out. And then I would make her hold this for 10 seconds. So she has to hold purely out and then come back up. Very good. So this like really burns the glutes, so you're not using anything else. Good job, girls. Thank you so much. Okay. Okay. So the take-home message for today is a big one. So as you can see from one dance move, there are so many variables and body parts that are affected, and that can affect the mobility of the move. And that's why it's so important for us as dance medicine specialists to treat you as a dancer as a whole and not a specific body part or injury, okay? So, of course, contact me. The most important part is to know that people like us exist. We can help you, we're here for you. If you follow the Instagram Aquacare Dance Medicine, I post a lot of what we're doing day to day in the clinic and certain exercises. You can reach me through there. My email's up here. We're going to open up the floor at the end for any questions you may have. But next, I'm going to introduce Dr. Andrew Curley up here. He's orthopedic surgeon for Tidal Health.
So a couple of questions before we get started, and thank you guys for the invitation to speak here. This is great that we're, you're setting this up and we're getting out into the community to talk about this. And it's a pretty unique patient population dealing with dancers. The demands that you folks put on your body throughout your performances, it's unlike any other sport. A couple questions for you folks before we get started. Who here ballet is your primary dance that you do? Okay, so probably a little bit more than half. Who does some other form of dance other than ballet as your primary form of dance? Okay, so about half and half. Okay, all right. This talk, it's geared a little bit more towards ballet, but a lot of the things I talk about here, they apply to other forms of dance as well, okay? So a little bit about me. So I work for Tidal Health. I'm an orthopedic surgeon. My offices are in Seaford and in Millsboro. I did medical school and residency at Georgetown University. I did additional fellowship training in sports medicine at the University of Pittsburgh. We worked with the Pittsburgh Ballet a little bit while I was up there. And then I also did additional fellowship training in hip preservation at the American Hip Institute. My surgical and clinical focus are disorders of the hip, the shoulder, and the knee. So the question you might be asking yourself, why does this guy have an interest in dance medicine? This is a picture of me my senior year playing football, attempting to stretch before the game. I can barely touch my toe, so how can I relate to a dancer? And it's a valid question, and the answer is this is my wife. She was a former ballet dancer. She had hip injuries herself. She underwent hip arthroscopy surgery while I was in training as an orthopedic surgeon. So seeing her go through this process as a patient, I kind of saw it from a different perspective. And now I'm on the other side of it as a clinician treating dancers. So, seeing my wife go through it, my goal is to kind of improve the process, make things better for patients that come through our clinics, so that you don't have quite the same experience that she did and you have a better outcome. So as Katie mentioned, we've published a little bit on dance and specifically dance injuries of the hip in various peer-reviewed journals. So I'll talk about a couple of these studies throughout this talk. And then additionally, this is an infographic that we published in a peer-reviewed journal trying to teach other surgeons a little bit more about the basics of dance so that they can better treat ballet dancers. I'm going to touch upon a couple different studies and a lot of different topics throughout this talk, so I'm going to throw a lot at you here. But these are a couple take-home points I want you guys to walk away from this talk with if you remember nothing else, okay? And we'll come back to this throughout the talk. This will be the outline of the talk. We'll give a little bit of background about hip pain, particularly in younger individuals and ballet dancers. We'll talk about common hip issues that we see in dancers, and 3 of the most common issues, which are femoroacetabular impingement, or FAI, hip instability, which often occurs with hip dysplasia, and then snapping hip syndrome. And then we'll run through a couple case examples, and I'll briefly touch on surgery and then rehab after surgery. All right, so let's get started. So the traditional framework that orthopedic surgeons were taught when a younger patient comes into the office with hip pain, these are patients without hip arthritis, is that these younger patients fall on this spectrum. And on one end of the spectrum is hip dysplasia, and on the other end of the spectrum is femoroacetabular impingement. So what is hip dysplasia? Essentially, you have a shallow socket. The hip joint, it's a ball and socket joint. The socket is a little bit more shallow than the average person. This leads to under coverage of the femoral head, and it can lead to an unstable hip. And the traditional treatment that's taught for patients with severe dysplasia is a procedure called a periacetabular osteotomy, or PAO, where essentially you deepen the hip socket. And we'll come back to that later in this talk. On the other end of the spectrum are patients that are born with too much bone in their hip. And this extra bone that they have in their hip, it's called a cam or a pincer deformity, and I have some pictures coming up later in this talk. This cam or pincer deformity can lead to impingement inside the hip, and the treatment for that is, it's pretty straightforward when you think about it. We remove that extra bone through a procedure called an acetabuloplasty or a femoroplasty, as you see here. As we started to research hip pain in younger individuals more and more, we've started to realize it's a lot more complicated than that simple spectrum that I put up there. Dysplasia and impingement, they can oftentimes overlap and occur in the same patient. Sometimes you can have trauma, instability states, so it can get pretty complicated pretty quickly. For the purposes of this talk, I'm going to keep it a little bit more cut and dry, and we'll keep FAI as one topic, and we'll keep dysplasia and instability as another topic, but just know that they can coexist in the same patient. And then furthermore, when we factor in that dancers are different, they're different than any other athlete we treat. The demands that you put on your hip joint, it's different than any other sport that we encounter. This also makes it a little bit more challenging, and it's another factor that we have to consider when we're treating a patient that comes into our clinic. So getting into a couple hip issues that we see in dancers. So starting off with femoroacetabular impingement, or FAI. So FAI, the traditional teaching, once again, is patients are born with too much bone in their hip. And this extra bone, if you have it on the ball side of the ball and socket joint, it's called a cam deformity, as you see here. If you have extra bone on the socket side, it's called a pincer deformity. And if you have both, it's called a mixed deformity. This extra bone, I'll show you a video here. So this is a patient, they have extra bone on the ball side, that's the cam deformity. And as that hip goes through through a normal range of motion, that extra bone pinches up against the labrum inside the hip joint. And over time, this pinching and this rubbing on the labrum, it can damage the labrum, it can damage the cartilage inside of the hip joint, and lead to labral tears or cartilage damage. And you might ask, well, why does that matter? Well, the cartilage is what helps your hip glide smoothly throughout range of motion. And as the cartilage gets damaged over time, that can speed up the arthritis process. So our goal is to prevent impingement before it leads to hip arthritis. Now, I mentioned that it can lead to a labral tear inside the hip. What is the labrum? That's a question that I commonly get. The labrum is a fibrocartilaginous structure. It runs around the hip joint circumferentially, as you see here. I mean, it has a couple different functions inside the hip joint. It provides a suction seal and force distribution throughout the hip. So the analogy that I use is, we all remember these little suction seal toys that you put on the window when we were kids. and it holds that vacuum suction. You can imagine if you were to cut a hole in this suction seal toy, it loses that suction, it would fall off the window, and it's not as stable. So the similar concept holds true for the labrum and the hip. If there's a tear in the labrum, you don't have that same suction seal, and the hip kinematics get thrown off. Now, once again, we said, dancers are different. They're different than the typical patient that comes through our door. So, when I see a patient that's a dancer that is having hip pain, one thing that we have to consider is they could potentially impinge with normal hip x-rays. So just because they don't have a cam or don't have a pincer deformity, because they're putting their hip through such an extreme range of motion, their hips still can impinge with this normal anatomy. And there was an interesting study out of Switzerland several years ago looking at this. And they took elite ballet dancers, like you can see here, and they put them in a ballet split, and they MRI'd them while they were in that split, and they looked at their hip in this position. And they did a 3D reconstruction of their hip and evaluated it. And what did they find? They found that for these dancers, their femoral heads were subluxating or impinging in the hip joint, despite the fact that they had normal x-rays. So this is one thing that we got to keep in mind, when a dancer comes into the office, is they don't necessarily need abnormal x-rays to impinge in their hip joint because they're putting such unique demands on their hip. Okay. One other thing that we have to consider too is that dancers impinge differently than other athletes. So, for example, if I'm taking care of a soccer athlete and they're kicking a ball, they're kicking in front of their hip, so forward in their body. If we look at the hip socket, and this is the front of the hip socket and the back of the hip socket, where do you think a soccer player is going to impinge when they're kicking forward? In the front, yeah, exactly. So soccer players or other athletes, they typically impinge up here in the front of the hip from the 12 o'clock to the 3 o'clock position. Now, ballet, for example, it's different than a lot of other sports. Turnout is essential. A lot of the movements that you do, your hip is turned out, you're bringing your hip to your side. I'm not going to attempt to do this and embarrass myself, but we could bring someone else up here that would do that. So with those motions that you do, it's a different demand that you're putting on your hip. So this systematic review that was published 2 years ago, it shows that ballet dancers, they impinge differently than other athletes. They impinge in the back of the hip from the 12 o'clock to 9 o'clock position that you can see here. So this is something that if you're not looking for it, you'll miss it. So as Katie mentioned, it's important to get plugged in with a dance specialist, someone that understands the unique demands that you're putting on your hip so that you can be accurately diagnosed and treated. All right, so moving on a little bit, I'm going to talk about hip instability and hip dysplasia. Who here has heard of the term hip dysplasia? Have you guys, anybody heard of that? Okay, so some of you folks have heard of that. Okay, so when we talk about hip stability, what do I mean by hip stability? I mean things that keep the hip, the ball inside the ball and socket joint, keep it pressed in there, keep it snug, and keep it from kind of wiggling inside the ball and socket joint. So there's several factors that contribute to hip stability. So first of all, there's the bony structures of the hip. So the hip, as I mentioned, some patients are just born with hip dysplasia. The way that they develop their socket, it's a little bit more shallow than the average person. So you can imagine if your socket's a little bit more shallow, the ball is not covered quite as much, it can be a little bit more loose and it can wiggle a little bit more inside the hip, okay? We talked about the labrum and the suction seal that the labrum provides to the hip. That provides additional stability as well. And then there's the capsule and the ligaments that run around the hip. And oftentimes, particularly in dancers, they have hypermobility disorders such as Ehlers-Danlos syndrome, where their ligaments are a little bit more loose than the average individual. And this is something that we evaluate for when we come in the office. And why don't we do this really quick here? Why don't you guys stand up, everybody? We'll just do a quick exam of your ligaments, okay? So can you take your thumb and can you bring it to your forearm, okay? All right, so do it on one side and do it on the other side. If your thumb touches your forearm for one side, that's 1 point. If it touches it for the other side, that's another point, okay? Can you bring your pinky back past 90 degrees, okay? If you can do it on one side, that's another point, and on the other side is another point, okay? Do your elbows hyperextend past neutral? Okay, you get 1 more point for each elbow if they hyperextend. Okay, do your knees hyperextend when you straighten them? Okay, if they hyperextend, you get 1 point for each knee. Okay, and then lastly, can you touch the floor with your palms with your knees straight? Can you go all the way down?
Not right now. I can't even try. That's it.
All right, good. All right, I see a lot of hypermobility out there. All right, so each of those tests, each of those is 1 point, and there's a maximum of 9 points. That's called the Baton score. Keep in mind, if you score high on that, that doesn't mean you need to rush into the doctor and you're abnormal. It just means you're a little bit more flexible than the average individual. And that's something that we see, particularly in dancers, is that they're a little bit more hyper-flexible than the average athlete. And this, once again, contributes to hip instability. And then lastly, the muscles around your hip. You have a ton of muscles around your hip that help pull the ball into the ball and socket joint. If those muscles are weak or not firing correctly, that's another factor that can contribute to hip instability. As we talked about, some dancers have some risk factors for instability, and there are 2 studies out of Texas that actually looked at this for an elite ballet group down in Houston. And they took these elite ballet dancers and they performed hip x-rays on them. And of these elite ballet dancers, almost 9 out of 10 of them had some form of dysplasia in their hips, so very prevalent in ballet dancers. And then in a separate study, they took their blood and they sent their blood off to the lab and they looked for gene variants that predispose them to a higher Baton score or hyperflexibility. And once again, they found almost 9 out of 10 of these elite ballet dancers had hyperflexibility genes. So dancers in particular have several of these risk factors for hip instability going out there. So one of the questions that I commonly get is, hey, I have this hip dysplasia. Did dance cause my hip dysplasia? I've danced ever since I was young. Did me dancing over the years, did that put pressure on my hip and cause the dysplasia in my hip? And it's a little bit of a chicken and the egg question or a nature versus nurture question. Yes, over time, if you load your joint repetitively over time, can you alter the way that your joints develop? Yeah, it's possible. But on the other end of the spectrum, maybe you were born with a little dysplasia to begin with that made you a better dancer, so you decided to dance more because you were good at it, and then that process continued. So quite often I find it's a little bit of both. It's a little bit of nature and a little bit of nurture that leads to hip instability and hip dysplasia. All right, so that's hip instability, hip dysplasia, and then moving on, we're going to talk about snapping hip. Who here has had snapping hip themselves or knows someone that has had snapping in their hip? Okay, I see a couple hands going up and a couple shy hands thinking about going up. Okay. So snapping hip syndrome, whenever someone comes in, particularly a dancer, and they say, hey, I have this snapping inside my hip, one of the key things that we want to jostle out is the snapping coming from the inside of the hip in the groin area or the outside of the hip, because that cues us in whether it's the iliopsoas muscle or the IT band. So if a patient comes in, they say, hey, I have this snapping, it's deep in my groin area, it happens when I take my hip through certain ranges of motion. We're thinking more so that it's coming from the iliopsoas muscle, and this is a muscle that runs inside your pelvis, down through the front of your hip, and it attaches to your thigh bone. And when you bring your hip through a certain range of motion, if this muscle is tight, it will snap over the femoral head or the pelvic brim and give you that popping feeling inside your hip. Now, if someone comes in and they say, hey, I don't really feel it quite as much in my groin. I feel it more so on the outside of my hip, and it happens, maybe from when I bring my hip from extension into flexion. That's a different issue. That's caused more often than not from your IT band on the outside of your hip running over this part of your bone called the greater trochanter. So those are a couple things that we try and flush out in the clinic when someone comes in and says, hey, my hip is snapping when I'm dancing. So we talk about these three hip disorders that we commonly see in dancers. Well, how do we treat these 3 hip disorders? When someone comes into my clinic and they have this hip pain, what do we do for them? And really the first, second, third line of treatment is physical therapy. And as Katie mentioned, it's important to get plugged in with a dance specialist, someone that truly understands the demands that you're putting on your body, someone that can make the connections that, hey, this isn't just an ankle sprain, this isn't just low back pain, these things are connected. you really need to get plugged in with somebody that understands it and can see the whole picture and correct the problem that you're having. Now, I am a surgeon. There are certain surgical options, but really that's last line treatment. Our goal is to get you feeling better before we get to the point where we need to talk about surgery. So what can physical therapy do for you? And I know Katie touched upon this already, but I'll just briefly go over a couple things that I commonly see in dancers when they come into in the office. So there's certain muscle groups that oftentimes are a little bit weaker and they have lower tone. These are your abdominals or your core muscles. Then additionally your hip extensors and then your hip abductors and external rotators. These muscles are oftentimes a little bit weaker. They're not firing quite the way that they should. In contrast, certain muscle groups oftentimes are too tight, have too much tone. These can be your low back extensors or your hip flexors in the front of your hip. And you might be thinking, hey, these muscles, they're a little bit tight. Maybe I'll just stretch them out and they'll feel better. But like we talked about, dancers are hyper flexible. So if we take something that's providing additional stability to you and you stretch it out, you're gonna become even more unstable. So that's not necessarily the treatment for this. Oftentimes, what we try and do is we try and hit the core muscles or hip extensors and correct the whole kinetic chain by addressing these weaker or lower tone muscles. And oftentimes these other muscles will come out of spasm, so it corrects the whole process. So like Katie talked about, it's not as simple as looking at one problem isolated. You gotta look at the whole picture and treat the whole patient. Okay. So I'll run through a couple case examples here. These are all case examples of a dancer with weak hip abductors and how the same problem can lead to 4 different issues, okay? This is an 18-year-old female ballet dancer. She's coming in with low back pain into the office. She says, hey, it hurts over here, doc. Her therapist tells me when she's doing passe, she sinks into her right hip, as you can see here. This picture, she's not sinking quite as much, okay? But what's going on with this patient, okay? She's sinking into her right hip. Her hip abductors on her right side are weak, so she's compensating for those weak hip abductors, trying to keep her pelvis level by overworking her low back muscles on the other side. So how do we get this patient feeling better? If we can strengthen these hip abductor muscles, once again, we can oftentimes bring this muscle out of spasm and get the patient feeling better. All right, let's take that same patient again. Okay, 18-year-old female ballet dancer, once again sinking into her hip, but this time she's saying, hey, I have this snapping. It's on the outside of my hip. I feel it out here. It happens when I bring my hip, from extension up to flexion. What do we think is going on with this dancer? Okay, so like we talked about, there's a couple different forms of snapping hip. When it happens on the outside of the hip, we're thinking that this is the IT band. So this patient, once again, she has weak hip abductors. This time she's leaning into her IT band for additional support. That causes her IT band to tighten. When her teacher tells her to correct by pulling up on her support side, she pulls up and then the IT band snaps over the greater trochanter. She gets that snapping hip again. So once again, same root problem, weak hip abductors, but it can lead to a different symptom, this time snapping hip. All right, let's take a different patient now. This is a 20-year-old female dancer, all right? She's been told in the past, she saw a doctor way back when, you have a shallow socket, no big deal, we'll keep an eye on it. She's coming in with pain in her hip and her groin region. It happens at the end of dance class, not the beginning. She gets tired during dance class. At the very end, she feels this pain in her groin region. You also know that she's hypermobile. She's got a 9 out of 9 on that Baton score that we just went through. And once again, she has weak hip abductors. So what's going on with this patient? All right, this is a patient with hip instability. So going back to the prior slide that we talked about, what are some of the factors that contribute to hip stability in dancers? All right, so she was told, all right, she has a shallow socket, so her bone is a little bit more shallow than the average person. So she loses some stability through that. She may or may not have a labral tear. She's hypermobile, so her capsule and her ligaments, they're not providing the normal stability that they should be providing. And then on top of that, she has weak hip abductors, so her muscles are not pulling her ball into the socket joint. So when she's going through her dance routine at the end of her class, as her muscles get fatigued, these are the last things that are keeping the ball into the ball and socket joint. As those get fatigued towards the end of the class and they're not working quite as well, she starts to have these symptoms of hip instability. So how do we get her feeling better? Once again, strengthening her hip abductors can give her additional hip stability and address those symptoms. All right, and then last case example, let's take that same patient again, the 20-year-old female ballet dancer with hip dysplasia. This time she's coming in, she says she is snapping inside her groin region, okay? It's not on the outside, it's on the groin, okay? So what can be causing that snapping in the groin region? All right, so once again, she has weak hip abductors, all right? The hip abductors, are, they're the muscles that are help keeping the ball and socket joint. Those hip abductors are a little bit weak, so her body is compensating now. It's looking for another way to try and keep her hip stable. So what does her body do? Her body tightens up another muscle around her hip, her iliopsoas muscle, to try and give her a little bit more stability. Well, unfortunately, when this muscle now gets too tight, when she goes through her hip range of motion, that muscle snaps over the femoral head and gives her that snapping hip on the inside of her, in the groin area. Once again, internal snapping of the hip. So these are 4 case examples of how weak hip abductors, one root problem, can lead to 4 different types of symptoms in the same patient population. So it's important, as Katie mentioned, to get plugged in with a dance therapist that not only sees the symptoms but can see the root problem and address the root problem and get you feeling better. All right. So we'll briefly touch upon surgery and rehab here. So in terms of surgery for some of these hip problems, there's 2 broad categories. There's hip arthroscopy, where we go in with minimally invasively through small poke holes around the hip. We can shave down any sites of impingement and then fix any labral issues that we see inside of the hip. Alternatively, for patients that have a shallow socket or hip dysplasia, there's a different procedure called a periacetabular osteotomy, where you can deepen the hip socket. Well, how do patients do after these surgeries, particularly dancers? This was one study that we published while we were in Chicago, looking at dancers that underwent hip arthroscopy. And this study found that about 4 out of 5 dancers returned to dance after having a hip arthroscopy, and over half of them returned to their pre-injury level of dance or better, okay? And then what about periacetabular osteotomy? There's a study up in Boston that looked at this, and they found that about 2/3 of dancers returned to dance. So when you look at these numbers, you may say, those are pretty good odds, 4 out of 5, 2 out of 3, I'll take those chances. Well, it's not 100%, and I think that's important to keep in the back of our mind is, we don't want to get to this point where we're talking about surgery. We want to get to the problem in the physical therapy stage before we need to do surgery, where the outcomes are a lot better and a lot more predictable. When unfortunately we do need to go down the route of talking about surgery, one of the things that we need to consider is, when is the best time to get surgery, right? Dance season kind of goes year round, right? And this calendar, I found this online. This is during peak COVID, and it's an online schedule that's still 9 days a week. When I was in college, our football coach would tell us, you football players, you guys are the hardest working athletes out here. You do practice every day for hours. You're in on your free time watching film. You're hitting the weights, you're doing all this stuff. You're the hardest working athletes on campus, except for dancers. And he's like, dancers are out there, they're working 5 hours a day, every day. They don't have an off season. There's no downtime for them. When we have this discussion of, hey, we might need to consider surgical options, one of the questions we get asked is, how long am I going to be out of dance to recover from this surgery? And this is a common issue that we ran into. So when I was in Pittsburgh working with the Pittsburgh Ballet, we worked on developing a protocol to help get dancers back to dance a little bit sooner after hip arthroscopy surgery. So the traditional post-surgical period, you go through therapy phases when you're recovering from surgery. And oftentimes this isn't dance specific. You're just doing general exercises to get your range of motion and strength back. One of the things that we thought we could improve upon was including ballet specific physical therapy to get you back to dancing sooner and get you back to performing earlier following surgery. And so we developed these phases. I worked with a physical therapist friend of mine who was a ballet dancer, as well as the folks from the Pittsburgh Ballet to develop this. But long story short, there's certain ballet phases where as you get further and further out from surgery, you might start with hip motions below the waist. As you get further out, you can bring your hip above the waist. Once again, I'm not going to embarrass myself trying to do that. And then, as you get out to the final phases, you do more complex things, rotary motions, you do your jumps, things like that, all with the goal of trying to get you back sooner to dance. And then once again, coming back to the original question, when is the best time to get surgery? Truly, the answer is never. No one ever wants to take time off to get surgery. The goal is to avoid surgery if at all possible. So there was a study that was recently published a couple years ago, once again out of Texas, and they did this randomized controlled trial for elite dancers, where they took half the dancers, they put them in one group where they put them through this injury prevention program, kind of what Katie was talking about. And then the other dancers, they did their typical protocol that they were doing without the dance injury prevention program. What they found is that the dancers that did do the injury prevention program, they had an 82% decrease in dance-related injuries, which is pretty substantial. So I think the main takeaway here is if we can prevent injuries before they happen, that's best case scenario. So going back to my take-home points, some common issues that we see in dancers are femoral acetabular impingement, or FAI, hip instability, which often comes in concert with hip dysplasia, and then snapping hip syndrome. Regardless of which of these issues, we see usually the first line of treatment is physical therapy, particularly with a dance specialist that understands your needs. And then finally, if you can get plugged into doing an injury prevention program, oftentimes that's the most effective way to prevent any injury from occurring in the hip. All right, thank you guys.
Well, hi, my name is Gwyneth. I'm a registered dietitian, and I work and I do one-on-one nutrition counseling for the most part, with a variety of clients, from I think like 12 to 82 probably, or something like that, with a variety of goals. I love working with just a variety of people. I have also the privilege to work with a lot of athletes where I am, just because I do work at a fitness facility, and so there are a lot of people who are trying to be healthier, very active, and so one of my main goals for athletes, whether they're runners or they play lacrosse or they dance, is to feel your body properly for the activity that you're doing. I think our goal today is to kind of, if I got to talk to you for 20 minutes about nutrition, what would I tell you? And so there's going to be a lot of topics kind of all over the place. But dancers are at a very high risk of underfueling for a variety of reasons. Dr. Curley was talking a lot about your schedule, right? When you're dancing so much and you have school to balance everything, it's really challenging to eat enough to fuel your exercise. But there's also a body standard in dance that makes us fearful of eating or fueling our body at times. And so you don't have to raise your hand or anything. But I danced, a long time ago, not competitively or anything. And there is, like, when you're staring at yourself in a mirror all day long, in a leotard with tights, you compare yourself to other girls, and dancers are 3 times more likely to develop an eating disorder because of, body standards in dance. However, there are a lot of problems that come from that because our body needs fuel. And so I have some written down here, and we'll talk through them a little bit on that risks of underfueling. But lower metabolic rates, menstrual dysfunction, or we call that amenorrhea, lower bone mineral density, and increased risk of injury. I think about this sometimes, like the calories that we need in a day, it's almost like a budget, right? And so if your body needs 2,000 to 2,500 calories per day to just do your daily living, right? And your exercise. So your body needs to fuel your heart so that your heart can pump and deliver blood to your body. Your body needs to fuel your lungs so that you can breathe, expand and contract. Your body needs to fuel your kidneys and so they can filter out your blood. And so our body's doing all of these things without us even thinking about it. It helps our hormonal health, tells our body, tells our brain to work, everything is working, but it needs energy for all of that. And then we're telling it, okay, I also need to fuel 2 to 3 hours of practice, every night for dance as well, which is a lot of energy that your body just needs to expend. And so let's say that our body, the requirement is maybe 2,500 calories a day, and that's just a blanket number. But we're only giving it 1,800 or 2,000 calories. It has to decide what to prioritize, right? And so Just like if your bills were $2,500 and you only made $1,800 a month, you have to prioritize what you're going to spend your money on, right? And so all of a sudden, you're probably not going to turn off the lights right away, but maybe you're not going out, you're not really having fun anymore, right? Because you have to cut back. You buy cheaper groceries, or you maybe pay a bill late, you know, but then eventually the water turns off and the electricity turns off, and our body's not working, or your home's not running at the same level that it needs to. And so we see that a lot in females. Our body's like, well, we're not getting enough, and so we don't need to have a period, right? We don't need a cycle, because that's like extra stuff. Or we don't need to have clarity at school. Our brain doesn't need to function at its best because I need to exercise later. I don't need to, my hair quality might go down, right? All of a sudden, my hair is more brittle because my body's it doesn't have the extra anymore. And so there are a lot of symptoms of underfueling that maybe we don't think about as underfueling, but a lot of mental health issues can come from that as well. Maybe a little bit more anxious, or low energy, depressed. Like those kind of things can happen too, just when we're not fueling our body properly. So I think that's just something to think about. And so today, my goal is to inspire you to give your body what it needs to fuel your exercise and everything else, so that you're, at tip-top shape and preventing injuries. And so we look at, what do I need? Each dancer is different. That's very, very important. So our, gender, body weight, age, height, activity level, they just vary from person to person. So therefore, our energy needs, or our calorie needs, will vary from person to person as well. So don't compare what you're eating to the person next to you, because we're all made differently, and so we all need to eat different amounts of food. However, it's a good rule of thumb that, if you're a dancer, you probably need 3 meals and 2 to 3 snacks per day. We really shouldn't be skipping meals or skipping snacks. We need to be eating consistently through our day. Also, at least half, 50 to 60% of our calories should be coming from carbohydrates. Anybody hear that carbs are bad? Anybody heard that? Everyone hates carbs these days, but carbohydrates are so important for our energy. It's the easiest thing for our body to take and then turn right into energy, and it's efficient. It's just the easiest thing. And so before practice, or before you exercise, we really do need carbohydrates to fuel our body well. So 50 to 60% of our calories should come from carbs. Before practice, we should have, or a rehearsal, sorry, we should have a meal 2 to 3 hours before that, with maybe even a snack like right before. I know you don't want to be like sick during your practice, but a mainly carb snack is perfect before, because then you have the energy in your bloodstream to exercise well. And then for longer rehearsals, I don't know, what's like the longest rehearsal that you guys will have?
6 hours.
6 hours? 8 hours? I did not dance competitively. We were like 45 minutes in and out in our class. But yeah, so you need to have snacks with you for those long rehearsals. You can't go that whole time without eating. That's just running on empty. So having meals and snacks available through those long rehearsals is really, really crucial. And then another, important part, I think, is having variety and flexibility in your eating. Anybody like to eat like the same thing every day? Yeah. Yeah. It's easy, yeah, sometimes. We pack our lunch, right? It's like the same stuff we put in there every day. That's fine, right? There's nothing wrong with that. It makes it easy sometimes, but I think sometimes it's fun to include more variety. It helps like decrease the monotony of our eating, and so it's always nice to include more. Does anybody know why? Have you heard like eat the rainbow? Yes. Anybody know why they say that? Yeah. It is healthy, yes. Yeah, absolutely. Anybody know why it's healthy to eat the rainbow? So each color that we eat does have like its own, we call them phytonutrients. You say phytonutrients. phytonutrients. So phyto means like color, and so each color does represent its own specific benefit, right? So red foods do a certain thing in our body, and orange foods do another thing, and yellow and blue and green, purple, white, especially the white ones. We always forget about the white ones, but like potatoes have benefits too. And so all of these things, we want to include a variety in our diet. And so if you only like one vegetable, maybe that's okay, but maybe we want to increase our palate a little bit to include more variety. Those colorful foods also contain fiber. Does anybody know what fiber is? Yeah. Maybe, maybe not. Fiber is found in carbohydrates, something that we don't digest, but it helps keep us regular in the bathroom, which is really important. Helps balance our blood sugars. It can help lower our cholesterol levels. It helps support a healthy gut microbiome. And so it's important to include a lot of fiber in our diet. But a lot of the fiber is found in those colorful fruits and vegetables. And then more variety can also lead to a more positive food relationship. So we don't just get tired of eating the same thing over and over again, because that can be monotonous. Okay. So I wanted to give you guys some snack ideas for dancers. I have a little like combination that I like to include when I'm planning my snacks. And I like to have color in my snack, and then a combination of protein and carb. And so I have some ideas there. In the first one, where's the color? Can you see it? Peppers, yeah. Anybody have a favorite color pepper?
Yellow.
Yellow, red. The green one's always the cheapest one, but it's not the, it's the grossest one. Then I'm like, oh, do I buy it? Like the tricolor pack. So we have color. Where's your protein? Hummus, yeah, and then the carb is, yeah, perfect. Where's the color in the second one?
Apples.
Yep, and then protein is
Nuts.
and carb is.
Butter.
Oh, the apple.
Oh yeah. Well, peanut butter has a little bit of carbs, but mostly in the apple. Where is the color in number 3? Yeah, and then protein, yogurt, yeah, and carbohydrate, granola, yep, and the berries, and then color in the next one.
Pineapple.
Yeah. Anybody like cottage cheese? Yeah. Okay.
Me too.
Good. One time my sister like made it at home and she completely ruined it for me, so I don't like it. But she like it was gross. But where's the protein in that one? Yeah, cottage cheese and Greek yogurt are actually like really great protein sources. So you probably don't want to pack like a chicken breast for a snack in between like dance practice. I mean, you could. Nothing wrong with that. But like cottage cheese and Greek yogurt are really easy, and you can grab the little individual containers for those. And the carb in that one is the pineapple. And so then the next one, where's your color there? Yeah, the fruit. Perfect. And then protein in the, yeah, or Greek yogurt. Protein powder is a good option if you need it. You guys, like, and we're talking about muscle recovery, building muscle to support, you know, your joints and everything. You might need more protein, especially if you're recovering from an injury. But I don't like to do more than one sort of protein supplement a day. So if you're doing like a protein powder in a smoothie or a shake or a bar, we get benefits from animal and plant-based proteins as well. So I like to include a variety of different protein sources in our diet. Perfect. And then the carb in that is also the fruit. Yeah, fruit has carbs. That's good. And then anybody like the balance breaks? Yeah. Perfect. You can buy them like that, or you can make them at home. But if you have fruit, nuts, and cheese, where's the color coming from? The cheese has color, but doesn't really have phytonutrients. But I'll count, so you can count. Protein is in the nut, and cheese, good, it's a little high protein. And carb would be in the fruit. If we did the next one, baby carrots with Greek yogurt, dip, and crackers, where is the color? Perfect. And protein and carb. And then like a half peanut butter and banana sandwich or a whole peanut butter and banana sandwich. That can also be a snack. Where would the color come from? Protein would be in the peanut butter, and then carb would be the perfect. Anybody have like a different favorite snack that might fit this formula? You say string cheese? No. Oh, celery and cream cheese. Yeah, perfect. So you have the color is the celery, and then protein / fat, which is good, and the cream cheese, good. And you could probably add fruit to that or something as well, or crackers to get a little bit more carb, like especially if you're going into a workout. Any other favorites? Oh yeah. Oh, that's perfect, right? Okay, so you tell me, where's the color?
Celery.
And the protein?
Peanut butter.
And the carbs? Nice, good. Yeah, any other favorites? Yeah.
I sometimes have this going on too, but sweet potato with yogurt and cinnamon, and then like a little fruit that, I don't know, I like pomegranate.
Oh, yum. Yum, yum, yum. Perfect. So you have color in the,
Berries and sweet potatoes.
and then protein
Yogurt
and carbs in the,
and sweet potato.
yeah, perfect. Nice, I love it. Any other favorites? And it doesn't have to be complicated. It could be, you know, like half a turkey sandwich too. It doesn't have to be anything crazy or fancy, but I think the most important part is that we want it to be easy and convenient for you to grab. Because there are probably some favorite snacks that don't necessarily fit this formula, right? So what do we typically eat as a snack maybe before? A bag of chips, right? Which has some carbs, right? But we're missing some parts. Any other favorite snacks that we might go to? Beef jerky, yeah, beef jerky. So you get good protein there, but we would want to add to it to make it a little bit more better. Great. Awesome.
Calling dinner.
Very good. So there are benefits, and I think it's important to think about, okay, so if you did have a bag of chips or popcorn or something, that's fine, but like what can we add to it to make it a more well-balanced snack before you go and train and give your body what it needs, right? Okay. We'll just go through kind of these 5 key takeaways next. We talked a little bit about carbohydrates already. So just to review though, what are some foods that have carbohydrates? Fruit, yeah, we learned that one. Bread. What else has carbs? Breads and pastas. Crackers, yep. Dairy products also have carbohydrates, so things like yogurts and milk, they have carbs in them. Beans have carbs, and so if you like beans, they have protein and carbs. It's kind of like a nice way of balancing it all together. But carbohydrates, again, if we don't eat any carbs, our body can adapt and use other things for fuel, but it is far easier for our body to take carbohydrates very fast and turn it right into energy. And so if you have an hour before you need to be out there competing or for practice or rehearsal, I don't even know what you call it, class, then that's when we want to have like a mostly carb snack, right? Because that's easy to digest and turn into energy. So please don't give up carbs. The second one is, like, we also don't want to fear fat. Fat does have calories in it, but fat is really, really important in regulating our hormones, for vitamin absorption, and it makes us feel satisfied at mealtime. So if we cut out fat, we tend to not feel as satisfied at mealtimes. We also want to make sure we're eating regularly. I think one of, just a really good rule of thumb is to eat within a couple hours of waking up. So try not to skip breakfast. I know a lot of times if we miss breakfast in the morning, if you're at school, you probably don't get it till lunch and we can't eat in the middle. So try to eat something when you wake up. And then we should be eating every 4 to 5 hours after that throughout the day. So at a minimum when you wake up, and then every 4 to 5 hours after. And then as much as we can, adding more color. A really simple recommendation that like the Academy of Nutrition and Dietetics put out there, which really hardly anybody meets, is 5 servings of fruits and vegetables a day. It's simple, but it's not easy. And so if we can just really focus on, can I get more fruits and vegetables into my day, that can be really helpful. So just adding more color where you can. And then I think the last one's really important just for that flexibility piece. We want to make choices and not rules, right? So when we can, and make a healthy choice, let's do that. But we don't need to be following any set rules for ourselves. Really, all foods can fit in moderation, especially when you guys are expending so much energy, just dancing so much. So we want to make sure that we're supporting our activity. If we're just following rules, it can lead to disordered eating patterns, fear, and monotony around our eating. And so we want to learn how to make choices for ourselves instead of just following rote meal plans and things like that. Because you guys have food wisdom within you too. You can know and trust your body what it needs. Okay? So I didn't do an intro or anything. I do take clients and I accept health insurances. And so if you have Care First or Cigna or Aetna, I also have a co-dietitian with me. Her name is Michelle. I probably sound winded because I have a baby in my belly, and so I will be eventually on maternity leave, but Michelle's great as well, and she'd be happy to work with any of you if you have questions about your nutrition and eating and fueling your body for success over, the next, decade of dancing, okay? So that's all I had, but I guess afterwards we'll do questions if you guys have any. Okay, thank you.
While I'm sad that I cannot be there in person with you all today, I am thrilled to have this opportunity to speak with you about sport and performance psychology in dance and in the performing arts. And we're gonna jump in with both feet here by beginning with a little self-reflection. I want you to ask yourself if you have ever experienced any of the following things. And this is not a comprehensive list, but it touches on a lot of stuff. Have you ever experienced performance anxiety, fear of failure, injury, rejection, casting disappointment, burnout, low confidence, difficulty focusing, or a lack of motivation? Although I can't see your responses to this question, I have a lot of experience asking this exact question. And that past experience tells me that many, if not most, of you have faced one or more of these challenges at some point in your journey in your craft. And you're not alone. I too experienced many of these challenges. Throughout my time as a dance student and as a professional dancer, I was lucky to have really thorough technical training that prepared me pretty well physically for the demands that I would face. But there was a pretty big gap in my training. Yes, I was prepared as far as technique and all of that kind of stuff goes, but my training never addressed the mental and emotional aspects of the performing arts that are so crucial for peak performance and for enjoyment. Mental and emotional tools and strategies are vital in order for us to be able to handle the intense demands that are placed on us and that we sometimes even place on ourselves. This mental aspect remains a generally overlooked component in many dancers' training and education. And as a result, while most dancers, if not all dancers, will inevitably face stressors, pressures, challenges, etc. throughout their careers, many of them will not have received the training necessary to handle and manage those stressors effectively, that mental training necessary. And therefore, we kind of leave our psychological state up to chance. And because of that, some dancers may never reach their full potential, in part due to this gap in training, Some dancers may enjoy their time less or quit or retire earlier than they would have otherwise, etc. And this is what brings me to our topic for today, which is the role of sport and performance psychology and mental skills training for performing artists. So, big question is, what is sport and performance psychology? I know I've thrown that term out there quite a bit already, so let's talk about it. Sport and performance psychology is a field of science that aims to help individuals and groups to reach their performance potential, to increase enjoyment and satisfaction, and to enhance well-being overall. So how then do sport and performance psychology professionals assist performers like yourselves to make all of those things happen, reaching performance potential, increasing enjoyment, enhancing well-being, etc.? We do this through psychological skills training or mental skills training. So through mental skills training, we equip performing artists and athletes with evidence-based, research-based tools to navigate and overcome the various challenges encountered by performing artists and athletes. Some of which we mentioned earlier, things like performance anxiety, stress management, confidence stuff, motivation stuff, all that good stuff. The efficacy of mental skills training is a big reason that fields such as traditional athletics, so soccer, football, those kinds of things, as well as military and corporate businesses have begun to really fully embrace sports psychology and even have sports psychology professionals on staff. And while there are a couple examples of performing arts institutions that have sport and performance psychology professionals on staff, the performing arts as a whole, we just haven't quite gotten there quite yet. But it's something that we're working on, bringing sport and performance psychology and mental skills training to dancers' normal and regular training and education. So why does mental skills training work? It's pretty common knowledge, I would say, these days, that your brain and your body are really deeply intertwined and really deeply interconnected. The things that happen in your brain affect your body. The things that happen in your body affect your brain. This connection is, of course, also extremely prevalent when we're talking about the performing arts and performing artists. To help us think about this and kind of conceptualize it a little bit, we'll use a little example here. And this example is actually from one of my clients when we had just started working together. So we hadn't really gotten into the mental skills aspect yet, but we were kind of sussing out what was going on. So this dancer had been rehearsing for a little over a month, and in the piece that she was rehearsing, there were a lot of pirouettes in that role. Everything, including those pirouettes, were actually going pretty well in all of the rehearsals, and she was feeling pretty good about things and pretty strong leading into her performances. Fast forward now to day of performance number 1, opening night. She was behind the main curtain practicing her pirouettes just to kind of make sure everything was okay, and they happened to feel a little bit off. And so she continued to practice them and practice them and practice them, and they still were feeling a little bit wonky, and maybe even more so the more she practiced them. She started to worry that she was going to mess them up or fall out of them or literally fall on stage. But at some point she had to take her place in the wings. The curtain was going to go up. So she took her place in the wings. She started to find that she was really, really stressing about these turns, really nervous about how they were going to go. Her muscles started to get really tense. She felt kind of shaky in her whole body. And eventually she had to make her entrance onto the stage, but she said she felt really distracted by these worries and almost like she couldn't connect to her muscles, and she wasn't able to dance the way that she normally had been able to dance this part. At the end of that performance, she felt pretty yucky about how the performance had gone. Her confidence took a major hit because of how that went, and yet she had 3 performances left to go. And all 3 of those performances left over, she said didn't feel so great because she was so worried about how everything was gonna go all the time. So I'm gonna stop there, but you can see how in this case, her turns and all of how she was practicing and they felt a little bit weird, that stressed her out and made her nervous, so it affected her mind. And that stress and those nerves caused excess muscle tension and shakiness, affected her body, as well as negative thinking, which is still in her mind. And those things seem to have impacted her ability to perform. And then the performances didn't go so well, so it impacted her mind again by impacting her confidence, and so on and so forth. So to get to the point, you can see through this example how the mind can influence the body, which can influence your performance, which can influence your mind, and so on and so forth. This example is also a really good demonstration of the fact that our performance abilities are not solely reliant on technical skill or physical prowess. Your performance abilities also hinge significantly on your mental skills and psychological state. In my example, that dancer was just fine in terms of technique. She had been working on it for over a month and it was great leading up to this. It was really her mind that started to get in her way. So when a performer is equipped with the necessary mental tools and skills to handle and manage the mental challenges that come their way, they often can perform well, even in the face of said challenges, and even enjoy their experience more. And that brings us to the benefits of psychological skills training or mental skills training. So on our list here, we have performance abilities. Performance abilities often increase when we engage in mental skills training, and I'll talk about the restoration versus enhancement in a second. Skill acquisition also tends to get better. We can learn more quickly and more effectively. Enjoyment and satisfaction go up. Injury outcomes tend to be better, and general well-being tends to improve as well. If you're interested in the stats and the research on all of these things, feel free to get in touch. I'd be happy to forward you a couple articles on that. But as far as the first one, performance abilities, restoration versus enhancement. So when we talk about mental skills training and performance abilities, we kind of go into 2 branches. The first one is restoration. So these are individuals who feel like their performance has taken a little bit of a downturn, or they're in a slump, and they want to get back to where they were before, or maybe even surpass that level. Then we have enhancement, which is I'm doing pretty well where I'm at, but I want to get better, I want to do better. I want to improve more, and that's where we come to enhancement. So performance abilities, we can restore them, or we can enhance from where you already are. We can also address a wide variety of different challenges, shall we say, some of which we mentioned earlier. This is, of course, not a comprehensive list, as I also mentioned, but performance anxiety, confidence, motivation, concentration and focus, perfectionistic thinking, burnout, skill acquisition, injury, return to activity from injury, emotional regulation. All of these kinds of things can be addressed through mental and psychological skills training. Okay, so we've talked about the what, which is sport and performance psychology. We talked about the why, which are all the benefits and stuff that we just talked about, and sometimes what can happen if you don't engage in mental skills training. And the how, which is mental skills training, right? Now we have to talk a little bit about the when, the who, and the where. Yes? So let's talk a little bit about those things. The where. If you're working with me, and most professionals, I will say, in this space, I do some in-person work, but I do a lot of virtual work too, which is really important for a lot of performing artists because schedules tend to be absolutely crazy. So that can open up some convenience to fit this kind of stuff into your very busy schedules. The who piece of this. The first thing to look for is a credentialed provider. Certified mental performance consultant, that's what CMPC stands for. You can find a certified mental performance consultant in your area or that works in your specific field and is knowledgeable about it on the Association for Applied Sports Psychology website, which I believe is appliedsportspsych.com, but you can find it pretty easily by Googling. And they have a provider list that you can search to find someone either, again, in your location or to find someone who works specifically in your field and is knowledgeable about your field, which can be so important. One of the biggest experiences I've had with my clients is that they come to me and they say, oh my gosh, thank goodness I don't have to describe what I'm talking about when I say fouettes or pliés or when I'm talking about an audition experience. Already being able to understand the world that you go through can be a really important part of the experience when you're looking for a provider. And then we have the when. So really the answer is there is no bad time to start mental skills training. Whether you're looking to address current issues in your performance or you're hoping to get proactive about enhancing your overall performance and well-being, there's really no right or wrong time to start, and it's never too late. Nothing is ever irreversible. So if you are wanting to connect, wanting to maybe work with me, or maybe just have some questions or are curious about a couple things, feel free to get in touch with me. There is a PDF printout for you guys with some other information, but feel free to get in touch via Instagram, via email. You can go to my website and find my email there as well. Or schedule a free consultation, and we can chat more about your goals and what you're looking to do. So thank you guys for listening to me. And again, I'm so sorry I couldn't be with you, but I'm so grateful that I had the chance to talk about all of this with you guys. And I hope you have a fantastic spring and summer. And I'd love to hear from you. So get in touch.